Hi, my name is John Flett. I'm a pediatrician who helps children, families, schools deal with kids that learn and think differently. Over my career as a pediatrician, and particularly dedicated to helping kids with ADHD, one of the biggest tragedies for me and the most dangerous type of ADHD is in girls, because it's just simply not picked up. It slips through that diagnostic net, unfortunately. You know, the the incidence of ADHD run about junior school, early junior school, is boys to girls, there is 3 to 1. In that middle school, high school, it goes down to 2 to 1. And in adults, it is 1.5 boys or men to girls. What that really means is that we're just not good enough at picking it up. And the impact of ADHD over a lifetime is so significant that I just want to draw your attention and help you think about either yourself as a woman, as a mother, or your daughter could have ADHD. Because unfortunately, you know, the boys are the ones that we traditionally think it must be a boy problem. You know, boys are the only ones that get ADHD. It's often because the boys have the type of ADHD that's that busy, impulsive, emotionally impulsive. They have the behavior problems, sometimes have oppositional behavior. So behavior problems and ADHD, it gets picked up quickly because it's intolerable for either a teacher or a preschool teacher or for parents at home. And of course, a lot of the boys that have ADHD often have associated learning difficulties. So those are the things that help draw it out. And boys are the ones that often get picked up early. So we're failing, I feel, girls with ADHD. The current research shows that unfortunately all the kind of research is based on males and boys. Rating scales are based mainly for boys and not girls. On my website, guyllittleminds.com, I've got under my assessments, there's a rating scale specifically for girls. And if that's something that you are concerned about, go ahead and fill that in and it'll come through to us and we'll get back to you. So you can see there's unfortunately a bias towards boys, and that's not so good for the girls. And of course, most of society expects so much of a different kind of expectation. A girl is expected to do so much more. You know, they're meant to socialize, work hard, have good handwriting, listen, do, and they have to compensate to achieve those things. And throughout a lifetime, that constant expectation, it comes at a cost of anxiety and depression. And there's also just this expectation from doctors and clinicians that if a girl or a woman has difficulties, they often come out of a doctor's surgery with an antidepressant or an anti-anxiety medication, rather than identifying and going through and understanding what is ADHD. So, you know, the consequence for girls, you know, untreated, you know, it has impact. The pressures, 38% of girls have teenage pregnancies. They have difficulty academically, socially. You know, the society expects so much more of women socially. So ADHD has a huge impact on social relationships, interacting, talking, making friends, keeping them. ADHD has a problem of emotional impulsivity, difficulty with keeping the thread of things, over talking. Some women have their hyperactivity demonstrated as just talking. And these have huge impact. And as a result, you know, women treasure social relationships maybe more than men. So in a condition like ADHD that affects social relationships more than anything else, it has a huge impact on women. So what I would say is, you know, it's almost like a self-fulfilling prophecy. You know, the the condition ADHD has been, so kind of stigmatized that a lot of parents don't even want to consider the fact that their child could have ADHD. And it's one thing having a boy with ADHD, but having a girl with ADHD seems to be more of a stigma. So the diagnostic criteria don't always take into consideration the inattentive type, because girls are the ones, those wallflowers. They're in the classroom, they kind of in the shadows, they don't impede, they're busy beneath the hood, they're busy kind of with their flight of ideas, but they don't necessarily demonstrate those behavior problems, kind of annoy, disrupt the classroom. They're the ones that kind of are the compliant, the inattentive type maybe. So these are just things that you should think about. The impact long-term, chronic, unexplained underachievement, not really fulfilling potential, just doing the bare minimum at school. Those girls that had social difficulties and really hated school. And as a result, their career prospects were kind of stunted. And there are a lot of women that I see in my practice, mothers, who you can see that their lives are chaotic, because they thrust into this role as a mother. And as a mother, you've got to be a superb manager. That's why women make amazing managers. Because, you've got to be able to logistically arrange not only your life as a woman, but your children's and, of course, your spouse. And, of course, if you have difficulties with time management, money management, your working memory, forgetful, it is a chaotic situation if a mum has ADHD. So, long-term anxiety, suicide, depression, these are huge impacts. It causes eating difficulties, sleeping difficulties, and is a vicious cycle. And of course, untreated ADHD has a huge impact on your child. So these are things that you recognize. These are things that you should discuss with us, because ADHD is the most treatable medical mental condition. The medication is the most successful medication, and it can reinvent your lives. I have seen untold number of my patients and helped families. Once a mother's treated, it can revolutionize the management of the entire family. So if these are things that you recognize, contact us. We'd be pleased to help you.